We were hearing early on, obviously around March time, when the news certainly became very salient around how pervasive this pandemic was, that there was evidence that people were suffering in terms of mental health, especially with this notion of the early lockdowns and so on. So very quickly, I worked with colleagues in Western Canada, and we rolled out a randomized trial called the Seniors COVID Pandemic and Exercise Trial, or SCOPE for short. And so in this trial, we had three conditions. We had a socially connected condition where older adults from right across Canada could sign up and engage in exercise every day of the week. So we offer these classes at 9 a.m. in the morning Pacific time, obviously 12 noon in the Toronto area, and then 1 p.m. Atlantic. And then so these classes, we recruited older adult instructors from West Vancouver who helped us out with this, men and women, and they delivered these classes, which involved stretching, core strength, aerobics, and much of what we did actually within our goal trial. Obviously, folks wouldn't have access to equipment that would typically happen in community centers, and so we try to set this up so that older adults could engage in these exercise classes based solely on equipment or things that people had at home. We sent out TheraBands right across Canada, so those stretchy bands that you can engage in resistance training. So we put those in the mail, sent those across Canada to everyone that enrolled. We also sent T-shirts, again, to foster the sense of connectivity. And then after each of the classes, so we delivered all of this through Zoom, and then housed behind a secure platform at UBC. And then what we did is we also provided older adults with the opportunity to connect right afterwards. And so some, while they may be living with others, a number of the participants were living at home and feeling quite isolated. So we had this social condition. We also had a personal condition. So these classes were matched with the group condition, in terms of still being led by older adult instructors, same intensity, same duration, but they could access those classes in their own time. So we pre-recorded them, we housed them on a secure platform, and they could then access those classes whenever they wanted. So we're just pulling all of the data together right now, and we'll hopefully submit this for peer review in the next few weeks. But I'll share some of the findings. I'm not going to share the totality of it, but the findings were quite interesting. So here are some of the data that we reported in terms of depression. So 0 is the control condition, and 1 and 2 are the social and personal conditions. So what we found, there was actually no difference. So 2 is the social condition, and 1 is the personal condition. So it looks like there's a slight difference, but there's no statistically significant difference between those two. But there is in relation to the control condition. So those who are engaged in regular physical activity reported lower levels of depression. We also see high levels of psychological flourishing, high levels of physical health, and the patterns are exactly the same across conditions. So after, we see no differences at time 0, which is before randomization. We then randomize them after those baseline measures, and then we see improvements in mental health amongst those who took part in these exercise conditions. So a couple of things come to mind. One is, I mean, the fact that there is no difference here between the group and the individual condition, but it's also noteworthy that those who are taking part in the individual condition, they're actually more folks who are actually living with other people, so they're probably getting that social connectivity at their home anyway. It also points to the fact that both conditions were beneficial, and indeed accessing a program that was led by an older adult instructor that they could access in their own time, and it didn't have to be synchronous. At the same time, they could benefit equally from that. So what this really points to is the benefits in the current pandemic context of engaging in regular activity. How are you doing for time? Okay. I'm just going to share some other related programs, but different programs that I think all point to the utility of connectivity and physical activity and various health outcomes. So one corresponds to obesity treatment, one corresponds to participants in with breast cancer survivors, and also a smoking cessation program. So First of all, there have been some programs that have tried to harness people's identification with different contexts. So this is the Football Fans in Training program. So this was for overweight and obese men, and they delivered this at Premier League football clubs in Scotland. So with overweight and obese men in their 40s, 50s, and 60s, often identify as soccer fans or football fans. So what they did is this was a weight loss program that was delivered at these clubs, and what they found was, relative to a comparison control condition, those in the intervention condition lost weight, and certainly significantly more weight than those in the comparison condition. And these were clinically meaningful differences, but also you'll see along the x-axis, this corresponds to time in weeks. So at 50 weeks, so over almost 40 weeks after that post-test, at the end of the intervention, they kept that weight off. Another study which I've been involved in with colleagues in Western Australia, this was slightly different, but this again was an overweight and obesity treatment program where they actually harnessed the power of identity or identifying with the sport of soccer. So in this program, they had overweight and obese men enrolled in a soccer league program over a period of time, and whereby they would get goals both for scoring soccer goals as you would in soccer, but they also were able to contribute goals towards the team based on their own individual weight loss and also collective weight loss as a team as a whole. And these are data that have just gone out for peer review. We haven't published these yet, so this is sort of hot off the press. But some of the outcomes are really quite promising. When you think that an effect size of 0.8 and above is a large effect, 0.5 and above is a medium size effect. In this study, we see weight loss that was both significant and a substantive amount of weight loss, improvements in physical activity, improvements in dietary intake, as well as improvements in various psychological outcomes, and including anxiety, body-related conceptions, and in this case, reductions in depression. Another program that may be of interest and relevance to some of you corresponds to the Abreast in a Boat program. So this was developed by my colleague at UBC, Don McKenzie, who's a physician cross-appointed in medicine and the School of Kinesiology. And they developed this program back in the early 80s and into the 90s and beyond, where initially the received wisdom at the time was that regular physical activity was not beneficial. In fact, would be quite problematic for those with breast cancer. And so Don's contention at that time was actually that it would be beneficial. And so some was suggesting, well, it'll just exacerbate any lymphedema that those with breast cancer might have. So they initially did a pilot study, and what started as a pilot study has now morphed into this global movement. And so physical activity has now become standard care for those with breast cancer and indeed multiple cancers. And both the physiological benefits and medical benefits are clearly there. And indeed, Don was highlighted in the Canadian Medical Association journal article, and it's referred to as Mr. Dragon Boat. But what's really quite interesting, and if you go to the website at the bottom of this, the links at the bottom of this slide, here's an example from one of the participants themselves who said, "We're a living symbol of hope and a vivid demonstration that there is life after diagnosis. Through the strenuous demands of dragon boat paddling, we have learned that we can push the limits of our physical endurance and have fun doing it." Another program of work I've been involved with Guy Faulkner, a colleague at the University of British Columbia, is the Run to Quit Smoking Cessation program. So this is a group-based program which matches both running in groups with smoking cessation. And so within this program, and it's conducted in partnership with the Running Room and the Canadian Cancer Society. And this program is offered across Canada. I know it's offered in Toronto and elsewhere. And what they found within this, and this is data based on a number of groups, what they found at over the course of the program is that relative to baseline levels, participants report reductions in smoker identity, as well as improvements in their identities as runners, as physical activity participants. What's also interesting too, in terms of how does that translate into behavioral outcomes, what the results of this work suggested that when those participants reduced their smoking or the smoker identities, this was associated with reductions in objective measures collected through what's called a smoke. I think it's called a smoke analyzer or smokealyzer. I think that I've got to get the term for that right. But in essence, it was associated with reductions in smoking behavior itself, and also improvements in runner identity was also associated with improvements in their actual engagement in running. And here's a quote from some of the qualitative work that's come out from this that really points to the utility of the groups. And one of the participants said, the big thing for me was the group, especially combining the group with the run. I desired to learn to get back to running too. So when you put the group and the running together, that was great. And so what we see and this is another meta-analysis that looks at interventions or programs that really look to foster a sense of connectivity. And I'm really mindful that this is very difficult to do when we have these stay-at-home mandates in the current pandemic. But there are ways of engaging in social connectivity and connecting whether it's with family and friends through Zoom. And this intervention, or this meta-analysis of intervention studies, so when they sought to foster a sense of connectivity, this was associated with quite large improvements in quality of life, physical health, improvements in self-esteem, well-being, reduced anxiety, reduced depression, improvements in cognitive health, and indeed reductions in stress. So when you pull all of this together, I'm mindful that there are a number of restrictions that we all face in the current pandemic context, and globally, I know things are very different in New Zealand, say, to how they are in Australia in terms of how things are in North America. But the data is just so compelling around the benefits of physical activity, and you don't have to go to the gym. I know that most gyms have been shut across the planet, certainly in North America they have, but you can engage in a lot of these activities and programs. I'll also highlight that the SCOPE trial that we just finished, that program is still now being run out of the West Vancouver Recreation Centre, and they're running these online classes for older adults, and they've kept the cost low. So if participants are interested in that, maybe I can ask you to direct your queries to Darren or Connie, and I can direct you to the relevant links and the sign up if you are interested in taking part in socially connected physical activity. And in fact, you'll be joining some of the participants within our SCOPE trial. So I'm fully aware there are a lot of challenges that we're all faced with, but given the compelling evidence around the benefits of physical activity, and indeed the World Health Organization points to regular physical activity as one of the great bangs for your buck, so to speak, that you can make use of in the current pandemic context. And if you can make it social and connect with others and doing so while being physically distanced, then that appears to confer some additional benefits. So with that in mind, I think we're at roughly around time. I'm happy to open this up to any questions.